Hi, Michael Moulton coming to you from the Epiclinic YouTube channel, and welcome. If you missed some of the videos that we've done before, don't forget to go back and subscribe, and you can get access to some of those. Some really interesting information, I hope, there. Today I want to talk about, would you go to a hairdresser's or a beauty salon if you had asthma? Blood pressure problems? No. What about diabetes? No. So why would you go for a medical procedure with prescription scheduled for medications, which is what we use in cosmetic medicine? Why would you go to a hairdresser's and a beauty salon to have those things done? These are medical procedures. It's crazy. I just don't understand why that would, but actually I do understand, because what happens is people get mixed up between medicine and fashion. It's almost like a radicalisation process that's going on at the moment. You see these girls with these humongous lips, and I hear people say, did you see somebody in our office? I don't know what they're thinking, but they don't look in, they look awful. They've got these huge lips and the cheeks all blown up and so forth. One of the greatest fears that I see when patients come to see me is, you know what they say? They say, you're not going to make me look like a freak, are you? That is a real fear, and yet they've had the courage to come along, have a consultation, all those hurdles that we talked about in the previous video, so go back and have a look at that. These things have to be in the hands of medical practitioners who prescribe these medications, because they're in our hands, because they have potential side effects and complications, and those complications, if they ever occur, need to be treated by an experienced person. And we've got this situation at the moment where we've got people in another state, a doctor who doesn't know anything about cosmetic medicine at all. He's sitting there getting $17.10 for every consultation that he does by Skype, would you believe? And then you've got a registered nurse in one of these shopping centres. What happens when something goes wrong? Is he going to jump on the plane when he knows nothing about cosmetic, he or she? Is he going to jump on a plane and be here an hour and a half and treat the side effect and complication? Nah. It's crazy. You need a registered medical practitioner to prescribe these products. It's okay to delegate it to a registered nurse who's had the adequate training, but the doctor needs to be on site or pretty darn close to wherever the procedure is being performed, so that anything that happens and they need advice, the nurse or whoever is doing the work can have that person on site really quickly and solve any problems that might come up. And believe me, these complications do occur. Often they're hidden because people are embarrassed that they've actually gone to see these people. So look, take my advice, make sure that you look for someone who's experienced. A medical practitioner has got to consult you in the original consultation, and don't go to beauty salons and hairdressers, it's just too dangerous. Thanks for coming, thanks for joining us. Don't forget to subscribe. We'll see you next time.